Hello friends, welcome back to my channel. In this video, we are going to see about the right atrial venous valves in primitive atrium. How the venous valves, that is superior vena cava, inferior vena cava, coronary sinus and the pulmonary veins, how it is just get into formation and get absorbed into the right atrium and left atrium. So that thing we are going to see in this video. So here, these are all the things which is going to happen in the primitive atrium. So we are going to see about the right atrial venous valves and left atrial venous valves too. Okay, let's move on to the video now. So now here, this is the right atrial part, and after the separation of the right atrium and left atrial part, the left venous valve. So here, this is the left venous valve which is incorporated with the development of the septum secundum. Now here the remaining part is the right venous valve. So this right venous valve, it is subdivided into three parts by two subendocardial muscular bands, and it just divides as upper and lower limbic bands. So now the upper limbic band is there, no, which extend between the orifice of superior vena cava and inferior vena cava. So upper limbic band. So here the upper limbic band is going to extend between the orifice of superior vena cava and the orifice of inferior vena cava. And lower limbic band, it is passes between the inferior vena cava and the coronary sinus. Now the part of the right venous valve cephalic to the upper limbic band is there, no? That join with the septum spurium, then it becomes rudiment. So this rudimentary part is going to persist as crista terminalis. The part of the right venous valve cephalic to the upper limbic band together with the septum spurium is rudiment, and that persists as crista terminalis. Now coming to the intermediate part of the venous valve, it lies between the two limbic bands. So this intermediate part with this sinus septum together forms the valve of the inferior vena cava. Now the caudal part of the venous valve persists as the valve of coronary sinus. Valve of coronary sinus. So thus the right atrium developed from three sources. The smooth part behind the crista terminalis is developed from absorption of enlarged right horn of the sinus venosus. And then the second one is the upper limbic part of right venous valve and septum spurium persists as crista terminalis. The smooth part behind the crista terminalis is developed from absorption of the right horn of sinus venosus. Then the upper limb part of right venous valve and the septum spurium persist as crista terminalis. Now the upper limbic part of right venous valve and septum spurium persist as crista terminalis. Then the lower part of right venous valve form valves of inferior vena cava and coronary sinus. Now the atrium proper in front of the crista terminalis, it is developed from right off of the primitive atrium, and that includes the formation of right auricle too. The ventral smooth part is derived from the right off of the atrioventricular canal. So like this, the smooth part and the rough part of the right atrium is occur in the primitive atrial development. Now coming to the left atrial part. So initially in the left atrium, the dorsal wall of the left atrium receive a single pulmonary vein. Then the single pulmonary vein which divides into two branches, one from the each lung. Each branch which is subdivided into upper and lower branch. So after the subdivision of this, all the four branches get into attached and forms the dorsal wall of the atrium. So all the four veins which get into incorporated to form the dorsal wall of the atrium. Thus, the smooth part, that is between the opening of the pulmonary vein, which is developed from the incorporation of the endocardial cushion of four pulmonary veins. So like this, the left atrium developed from left half of the primitive atrium, and most of the ventral part which is developed from the left half of the atrioventricular canal. So like this, the absorption of the four pulmonary veins, we can see it in the left atrial part. So this is about the venous valve in right atrium and left atrium. Uh, Thank you friends. Thank you for watching this video. If you like this video, please like, share and subscribe.